Welcome back. You've come to Menopause University, where I do everything in my power to reduce your risk of falling prey to the perils of menopause. I cover everything. There are no restrictions. Even if something has but a tiny impact on your menopause, I teach you everything about it. And in this unit, I'm teaching you about epithelial ovarian cancer. This is video number 449 in the whole menopause education I deliver here on YouTube. It's the 37th video in our unit on epithelial ovarian cancer. This unit started with video number 413. And the topic of this tutorial is menopause management after risk-reducing surgery for epithelial ovarian cancer. You will not find a separate section on this particular topic in my book. This one is an extra that is more specific than what I present in the book. Now, you already know that the only way you'll really know everything you need to know in order to reduce your risk of falling prey to the perils of menopause is to start with video number 1 and watch every single video in order. How in the world people think they can actually learn anything without doing so in an orderly manner will forever baffle me. But nowadays, with the internet, the ability to Google the answer to isolated questions, and sound bites everywhere, most people no longer learn hardly anything in an orderly manner. And then they wonder why they're so confused. I'll also never understand how people think they can get the personal guidance they need in a comment box. You are the biggest piece to any puzzle. Everything is always about the one and only you. So everything has to be tailored to the one and only you. Without the tailoring, all you have is basic science. So I present these videos in a way that applies to all women, but women are not robots. We are all quite different. The only way you will ever be able to personalize this education specifically to you is in a consultation. So if you want to get this education the right way and avoid getting into trouble, watch the videos in order and also schedule a consultation. Throughout my life, people have described me as a goody two-shoes. Goody two-shoes is a term derived from a children's story back in 1765. The author, an Englishman named John Newbery, popularized the label goody two-shoes to describe an excessively virtuous, well-behaved do-gooder. Well, as a goody two-shoes, I can't even imagine trying to learn something in any manner other than an orderly one. That's why I attend school, after school, after school. The thought of trying to actually understand anything without a formal education on it seems completely ludicrous to me. So when I wanted to understand business administration, I attended business school and got an MBA. When I wanted to understand law, I attended law school and got a law degree. And when I wanted to learn any language, I went to a dedicated language school for that particular language. I still do that today. But that's not the only area of my life in which I'm a goody two-shoes. I'm that way across the board. I was such a good kid, I was boring. I've never gotten in trouble for anything in my entire life. I don't know what it's like to have my parents angry with me. I don't know what it's like to endure some form of punishment. I don't know what it's like to be on restriction. I've always just thought it's so much easier to do things properly and stay out of trouble. And the reason I'm telling you this and talking about being a goody two-shoes is because it's analogous to what women do when they have risk-reducing surgery to prevent epithelial ovarian cancer. I taught you all about your various different options in the realm of risk-reducing surgery for prevention of epithelial ovarian cancer in video number 442. Today, I want to discuss your menopause management options after such surgery. Because I know that some women watching these videos are not goody two-shoes who watch the videos in order like I implore them to do, I always give you a bit of a review to orient you to the topic at hand and give you the background information you need for the current video. But never, never, never is it the whole story. Never is it a substitute for watching the previous videos. It's just a frame of reference so that you can put the lessons into perspective. So, you already know that risk-reducing surgical procedures are intended for women at high risk of getting epithelial ovarian cancer. Many of these women have a genetic mutation that greatly increases their risk over the average risk of 1.4%. In addition, there are many other risk factors that can significantly increase your risk of epithelial ovarian cancer. And despite the fact that genetic mutations increase your risk the most, they do not cause the most cases of epithelial ovarian cancer. Only 20% of epithelial ovarian cancers are hereditary. The other 80% are non-hereditary. Here's our familiar chart of risk factors demonstrating this. But regardless of the risk factors underlying any epithelial ovarian cancer, it is a disease for which there are no early symptoms, there is no screening test, and there is very poor 5-year survival rates. And because this is such an evasive, unpredictable cancer, many women opt for a risk-reducing surgical procedure in order to prevent it. These surgical procedures are the most guaranteed ways of decreasing your risk or preventing it altogether. So that brings us to our topic for today, which is menopause management after such a surgical procedure. Depending on the particular risk-reducing surgical procedure you have, you may or may not experience sudden post-menopause as a result of it. So rather than specifying your menopause management options for the individual surgical procedures, I'm going to address them generally, regardless of when your post-menopause begins. The fact is, after any risk-reducing surgical procedure, you're going to eventually reach post-menopause, regardless of whether or not the surgery induces it. The goal of any risk-reducing surgical procedure is to prevent epithelial ovarian cancer from developing in the first place. I have taught you that the cell of origin for epithelial ovarian cancer is the outer skin-like covering of your ovaries. So this saran wrap is the epithelial layer where cancer originates in epithelial ovarian cancer. And I've taught you that this saran wrap epithelial covering doesn't just cover your ovaries. It covers all the organs in your abdomen and pelvis. Well, none of the risk-reducing surgical procedures removes all the epithelial tissue in your abdomen and pelvis. That's precisely why nothing can reduce your risk of epithelial ovarian cancer to 0. So no matter which kind of risk-reducing surgical procedure you have, the most you can reduce your risk is by 90%. So the question for today becomes, if you were at high risk of epithelial ovarian cancer and had risk-reducing surgery to decrease your risk, what are your menopause management options afterward, given the fact that you still have this epithelial layer covering all your abdominal and pelvic organs and leaving you with at least a 10% risk? In other words, does the risk-reducing surgery restrict your options in any way, or are you risk-free? Here are some of the reasons women have risk-reducing surgeries to prevent epithelial ovarian cancer. They have a genetic mutation for epithelial ovarian cancer, or they have already had breast cancer caused by a genetic mutation that also causes epithelial ovarian cancer, or they have a cancer family syndrome due to an underlying genetic mutation that causes many different kinds of cancers, or they have a strong family history of epithelial ovarian cancer, or they are of Ashkenazi Jewish ancestry with a risk of epithelial ovarian cancer 10-fold higher than the average risk, or they have never been pregnant, or they have had severe endometriosis, or they have taken lots of fertility drugs, or their lifestyle is highly conducive to epithelial ovarian cancer and breast cancer. All of these are situations in which some women have risk-reducing surgery for epithelial ovarian cancer. And the question is, are menopause management options restricted in any way after risk-reducing surgery for any of these situations? Does having risk-reducing surgery for epithelial ovarian cancer put you on restriction? And if so, how does it restrict you? You know I'm all about being very specific in the way I teach. So how would you answer this quiz question? Which of the following accurately describes the restrictions on menopause management after risk-reducing surgery for epithelial ovarian cancer? A. If you have no genetic mutation for epithelial ovarian cancer, you have no restrictions. B. If you have no genetic mutation for breast cancer, you have no restrictions. C. If you have no genetic mutation for Lynch syndrome, which is family cancer syndrome, you have no restrictions. D. If you have no personal history of ovarian cancer, you have no restrictions. E. If you have no personal history of breast cancer, you have no restrictions. F. If you have no personal history of breast or ovarian cancer, you have no restrictions. G. If you have no personal history of endometriosis, you have no restrictions. H. If you have no Ashkenazi Jewish ancestry, you have no restrictions. I, if you have never used fertility drugs, you have no restrictions. J, if you have fewer than 3 risk factors, you have no restrictions. K, none of the above. There are no restrictions, period. I think the underlying question here has to do with restrictions on your use of HRT, hormone replacement therapy, after risk-reducing surgery for epithelial ovarian cancer. Non-HRT options don't ruffle anybody's feathers, but HRT sends most people into a complete tizzy. Well, if there are restrictions on HRT, what are they? Who can use it and who cannot? Where do you draw the line? You see, I want you to answer questions as a result of logic, not as a result of a knee-jerk reaction or fear. As you consider all the reasons for having risk-reducing surgery, all the facts about how it develops, and how much you actually reduce your risk by having the surgery, who should be restricted from using HRT? Should any woman be restricted from using HRT? Well, here's the quiz question again, this time with the answer in bold. There are no restrictions of any kind for any woman who has had any risk-reducing surgery for epithelial ovarian cancer. Remember, women who have risk-reducing surgery for epithelial ovarian cancer have not had the actual cancer. They had the surgery to prevent ever getting the actual cancer. But the surgery induces post-menopause for many of them, depending on the procedure they have. And they underwent the surgery to improve their quality and quantity of life. Well, post-menopausal estrogen loss can affect your quality and quantity of life also. Estrogen deficiency doesn't cause epithelial ovarian cancer, but it does cause heart attack, osteoporosis, and Alzheimer's. So, would it make any sense for a woman to undergo a risk-reducing procedure, experience sudden post-menopause as a consequence of the procedure, and then decrease her quality and quantity of life with these 3 diseases instead of with the one disease she prevented with the surgery? Life is all about trade-offs. But some trade-offs are entirely unnecessary. Prevention should not impose more restrictions. There is no logical reason for any woman who has had a risk-reducing surgical procedure for epithelial ovarian cancer to impose any restrictions on her menopause management. The goal is to put yourself in a win-win position. You avoid the epithelial ovarian cancer, and you have all options available to you for managing your menopause whenever it happens. I make up terms sometimes, and I have a made-up term for restrictions that are not necessary or logical. I call them artificial restrictions. And I find it both interesting and sad that so many women impose artificial restrictions on themselves. And the current menopause management practice styles of most physicians isn't helping any. It's only making things worse for these women. Doctors terrorize women about epithelial ovarian cancer almost as much as they terrorize them about breast cancer. They induce women to accept artificial restrictions against HRT use in both instances. And it's completely unfair to women. You need to know that there are no restrictions. Prevention should not impose more restrictions. If you have any kind of risk-reducing surgery for epithelial ovarian cancer, you are restriction-free, just as I was throughout my childhood and since. Now, my brother Ron was not restriction-free. He was a normal kid who got into trouble from time to time. I always hated to see him get in trouble for getting into trouble. And I think it bothered me more than it bothered him. In fact, I would go into my room and cry when he got punished for getting into trouble. I would artificially impose his punishment onto myself. You see, that's like an artificial restriction. Ron took punishment in stride. I think he always felt like the punishment was worth the opportunity to do whatever it was that had gotten him into trouble in the first place. One time, Ron got punished for driving the car without permission, long before he had a driver's license. I think he was barely 14 years old. But he was so eager to start driving, but he simply wasn't allowed to drive. Well, one morning, my mom noticed that something was awry with the way the car was parked in the garage. So she immediately suspected that Ron had driven it without permission. And being the savvy mom she was, she checked the odometer. She was always one step ahead of Ron's shenanigans. And ever since Ron started showing an interest in driving, she had kept track of the mileage on the car. But the odometer didn't register any additional miles since she'd last driven. Still, something seemed odd to her, and she suspected that Ron was up to something. Nobody ever suspected that I was up to something. I was boring. My father was away off on some military mission, as was often the case. So that night, my mom got up in the wee hours of the morning, and she went to the garage to see if the car was there. Gone. Aha! She said, I knew it. My mom used to always say that. I knew it. The door in our house that led to the garage door was in the laundry room. So after parking the car in the garage, Ron would have to enter through the laundry room, then pass through the kitchen, on through the den, and then down the hallway to his room. So my mom hid in the kitchen. She sat at the kitchen table in the dark, waiting for Ron to return. After about 30 minutes, she heard the garage door open. You couldn't hear it from any rooms in our house, except the laundry room and the kitchen. So she had positioned herself perfectly. A minute or so after hearing the garage door open, she heard the laundry room door open. That's when she slowly made her way in the dark to the light switch. And just as Ron entered the kitchen, she turned on the lights. It scared Ron to death. But mostly, he was embarrassed for getting caught. So my mom took Ron by the arm, marched him out to the garage, opened the driver's car door, and checked the odometer. And once again, the odometer showed the same mileage as the last time she had driven. Perplexed, she turned to Ron and asked, "What have you done to my odometer?" And with this impish grin on his face, Ron said, "I've done nothing to your odometer. I just drive the car in reverse." So Ron had been going out for nightly joyrides, driving the car in reverse the entire time. Not only had he learned how to drive, he'd become a master at driving everywhere backwards. Now remember, this was back in the early 1970s, before there were backup cameras and such. So to drive in reverse, Ron had to either use the rear view mirror or twist around and look backward. I think it was pretty ingenious. But the thought of his disobeying my parents mortified me. Well, the next day my mom gave Ron a choice. He could either be on restriction for a week or he could get a swat. A swat was a whipping or a spanking. Parents spanked kids when I was growing up. I never got a spanking either. Well, when given the choice, without any hesitation whatsoever, Ron said, "I'll take the swat." And he said it so quickly and with such nonchalance that my mom decided to really swat him like he'd never been swatted before. So she went out into the garage workshop where my dad had just about everything you could possibly imagine for making just about anything you could possibly imagine. And she found a long wooden board. It wasn't very heavy, but it was long and awkward for her to carry. Nevertheless, she dragged it to the backyard, called Ron to come out there, and told him to bend forward. She wanted to really let him have it, as they say. Then, with all of her 115-pound strength, my mom swung the board as hard as she could, landing it on Ron's butt with a single, sharp, slapping sound. It sounded so painful. I cringed and started crying. But Ron just straightened up and said, "Thank you," and trotted off happily. My mom was livid. My family is definitely odd. It was like musical emotions or emotional mix-up, with each person harboring the wrong emotion. Ron was happy. My mom was angry. And I was upset and crying. In any case, I told you this story because it's an example of avoiding artificial restrictions. Ron saved himself a week of restriction by just getting the swat. Then he was free. I mean, what kind of restriction was my mom going to impose on him anyway? Not driving? Any restriction would have been an artificial restriction in the sense that it would not have had anything to do with what he'd done wrong. The point is, just as a parent shouldn't impose an artificial restriction on a child, your healthcare providers shouldn't impose an artificial restriction on your menopause management. So, if you undergo risk-reducing surgery for epithelial ovarian cancer, afterward, you are free. You may manage your menopause any way you please. Okay, so thank you for listening to my story. I think it made the point. The summary for today is this. If you have any kind of risk-reducing surgery for prevention of epithelial ovarian cancer due to any kind of risk factor, you have all menopause management options available to you afterwards. There are no restrictions. But what if you actually had epithelial ovarian cancer? What are your menopause management options then? Well, that's what we'll address in the next video. Like my cliffhanger? I don't have a cliffhanger for enticing you to go to menopausetailor.me to schedule a consultation. But if you talk to any woman who's had a consultation with me, I'll never need to entice you. There's no way your menopausal life won't be greatly improved by a consultation. Other than that, be sure to subscribe here for everything. And be sure to follow me everywhere on Facebook, Instagram, Pinterest. TikTok, and Twitter. Bye!